Hi and welcome to our spine and torso visible body lecture. So as we can see, here's a sagittal view of the spine and obviously the skull. What we will probably notice first of all is that the spine is not completely straight like a lollipop stick. It has a series of curves in it. Now these curves are predominantly there to enable the spine to absorb and dissipate force, similar to the coils of a spring, how a spring can compress. Now, functions of the vertebral column. First of all, stability. It provides a stable base for the limbs to function, particularly the lower limbs. It protects the spinal cord by the vertebral bones forming a bony canal through which the spinal cord and spinal nerves will be protected therein. It supports the head and provides a platform for movement to occur. So, allows stability, protection, support and movement. Now looking at these curves, we notice there's some curves that go posteriorly to anteriorly. We call these curves lordotic curves, and there's two lordotic curves, one found in the cervical region and one found in the lumbar region. Then we have curves which go from anteriorly to posteriorly, and we find those on the thoracic region and the sacral region. So the spine works similarly to a toy snake we might remember from our childhood. If you remember those toy snakes that have multiple segments, and you would hold the tail of the toy snake and its head and the body would wave around, and those toy snakes represent a pretty good example of how the spine works, in that intersegmental movement between each segment of the toy snake or the vertebrae in this instance is somewhat limited. So between each vertebrae there's very limited movement, but the sum total of all those movements of those bones slash segments together creates a somewhat highly mobile yet rigid series of structures, and of course an overall structure. So a good way in which to think about the spine and how it works and its mechanics is that intersegmental movement is very limited between each bone. However, the sum total of all those movements together creates a highly mobile and highly rigid region. So the spine itself is the central axis of the body, and it's composed of 33 bones divided into 5 distinct regions. Each bone is known as a vertebrae, and each region has sets of vertebrae which are unique to that region, which gives each region its unique characteristic to allow for various functions. Now there's two real types of bony projections on the vertebrae that you should be aware of. A transverse spinous process, which is a bony projection which projects laterally, and a spinous process which projects posteriorly. Both of these processes are so that ligaments and muscles can attach to them. So let's take a look at the different regions of the spine. Firstly, we have the cervical region. Now the cervical region has 7 bones, and with the spine, every vertebrae has both a letter indicative of its region, so in this case it would be C, and its number in ascending order. So the first cervical vertebrae is known as C1. Now C1, which is known as the atlas, will revolve around C2, which is known as the axis. So if you can think of the world or the globe rotates around the sun, so C1 is the atlas, and that rotates around the axis, allowing us to turn our heads so we can look around. And that's a true pivot joint. Okay, so there's 7 cervical vertebrae, and the cervical spine is the most mobile part of the spine. It allows for flexion, lateral flexion, rotation to the left and right, along with circumduction. This is obviously advantageous as we have a skull on top of those cervical bones with a pair of eyes, so it enables us to look around and hunt for prey. Moving down, we've got what's known as the thoracic region. Now there's 12 thoracic vertebrae, each with a pair of ribs, which forms 24 ribs in total. Now the thoracic bones are distinct as they have spinous processes which are oblique and essentially sit on top of one another, which limits the amount of extension that can occur at this region. Much of the rotation that we can create in our spine comes from the thoracic region. And moving down, we have what's known as the lumbar region, of which there are 5 bones. Now the lumbar bones are thick and stumpy. This is so that they can absorb and tolerate greater forces, as this part of the spine is under the most stress because it's the body's central or the center of mass, if you like. And as I said, there's 5 of these vertebrae with peg-like spinous processes. Moderate amounts of rotation can occur around about the 10 to 15 degree mark. Some extension and flexion predominantly around the S1, so the first sacral vertebrae, and the L5, the 5th lumbar vertebrae. And moving down, we have the sacrum, which are five fused vertebrae, and they usually fuse by the age of 25 to 30. And moving down, we have our coccygeal, which is our sort of remnants of our tailbone, and this is can vary anywhere from 3 to 4 or 2 to 4. These are fused vertebrae by the ages of 26. So let's take a look at some of the muscles involved in this region. Okay, so let's start looking at the musculature at the back of the body of the spine, so the posterior view. So predominantly the muscles here are of the erector spinae group. Now within the erector spinae group there's obviously a left and a right side, and what I've highlighted here is on the left side is the deep layer, and on the right side is the superficial layer. So let's start with the more superficial muscles. Now the first superficial erector spinae is a muscle group called iliocostalis. Now these muscles run from the ilium, hence the word ilio, and the ribs. The word costal implies rib, and they're in their different regions of the thoracis and the lumborum and the cervicus. Iliocostalis causes lateral flexion of the spine, rotation, and with the bilateral contraction, extension. Then we have longissimus, which is another erector spinae. It essentially does a very similar role when working unilaterally, so single-sidedly. It causes lateral flexion or rotation. When worked or contracting bilaterally, as in both sides, you get the net movement is extension. And finally, in the superficial layer, we have spinalis, which is again another erector spinae, which causes extension when working bilaterally, and single-sided contraction will elicit either lateral flexion or rotation. So let's now have a look at the deeper layers of the erector spinae. Okay, so we've got a muscle group called multifidus or multifidi for plural. These stabilize each vertebral bone by attaching from one spinous process of a vertebrae to the superior vertebrae above it. And as I said, its job is to predominantly create stability of the spine between each vertebrae, but also will aid in extension if both sides contract together, lateral flexion for a single-sided contraction, or indeed assist in rotation. And the second of our three deep erector spinae muscle is the semispinalis. The semispinalis has an origin on the transverse process of one vertebrae to the spinous process of the one above. It again, like all the erector spinae, will create extension when a bilateral contraction occurs, lateral flexion and rotation when a unilateral contraction occurs. And finally, we have the rotatores muscle. Now, the rotatores muscles originate on the transverse process of a vertebrae, as you can see there, and to the sort of spinous process of the vertebrae superior to it. Now, these have such a small cross-sectional area in that their overall size, based on how far they have to pull, is so small. It's considered they don't actually act upon the spine to a great deal. What is interesting about these muscles themselves is that they have a very high density of muscle spindles, and muscle spindles are sensory receptors which detect any change in muscle length. So there is some thought that they do contribute to overall proprioception or spatial awareness, and play such a role, and have a proprioceptive role. Okay, and finally, of our final posterior spine muscle, we have a muscle which isn't truly part of the spine so much, but it is certainly a torso muscle, and that's a muscle called quadratus lumborum, shortened for QL. Now, this muscle attaches from the 12th rib, so the last floating rib, and then the transverse processes of L1 to 3 down to L4, and to the posterior third of the iliac crest. So this muscle will cause lateral flexion when a single-sided contraction occurs. If you get a bilateral contraction, you will get extension. They are also a respiratory muscle, and they can brace the lower ribs for forced expiration or breathing out. Okay, moving to the muscles of the anterior abdominal. We'll start from the most outside and move into the deepest layer. So we'll start with the external oblique. Now, the external oblique has an origin on the lower 8 ribs and inserts on the iliac crest, the pubic tubercle, and the aponeurosis of the anterior rectus sheath, which is this abdominal fascia at the front here. Now, external oblique's actions are to support the abdominal wall, assist with forced expiration, so breathing out. They do aid in raising intra-abdominal pressure, but their concentric action is either rotation, lateral flexion, or if you get a bilateral contraction, the net movement will be flexion. Okay, now underneath we have the internal obliques. Now, the internal obliques have an origin on the thoracolumbar fascia, which is that white diamond-shaped fascia of the lower back, the iliac crest, as you can see there, and the lateral 2/3 of the inguinal ligament, which is this ligamentous structure which runs from the ilia to the pubis, which forms the inguinal canal. Their insert is on the costal margin, so the margin of the ribs, the aponeurosis of the rectus sheath, both anteriorly and posteriorly. Their action is similar to their external obliques. The right external oblique will run in a similar arrangement to the left internal oblique. So the right external oblique will run essentially across the body and connect via that abdominal rectus sheath, and vice versa. So the internal obliques on the right will work with the external oblique on the left, and vice versa. So the internal obliques, when they concentrically contract, you'll get a lateral flexion movement and a rotation movement, and when you get a bilateral contraction, you'll get forward flexion. Okay, then we've got rectus abdominis. Now, rectus abdominis is a strap arranged muscle. There's obviously a left and a right side with a dividing linea alba, which can widen and elongate during pregnancy. So the rectus abdominis is actually just one muscle on each side with a interdigitation, which is a sort of transverse tendinous structure, which essentially bunches these fibers up and increases their strength. Now the rectus abdominis will cause forward flexion and bring the ribs down to the pubis, but they'll also bring the pelvis up towards the ribs and cause a posterior pelvic tilt. They can also increase intra-abdominal pressure by compressing the tummy, but they also aid in lateral flexion and rotation. They have an origin on the pubic crest and pubic symphysis, and they insert to the 5th, 6th and 7th costal cartilage of the ribs, and to the xiphoid process, which is just that cartilaginous projection that we find at the base of the sternum. Okay, now we're going to look at a muscle called transversus abdominis. Now the transversus abdominis muscle essentially wraps the abdominal wall in a corset, and is known as just that, the body's natural corset. Its origin is on the thoracolumbar fascia, the iliac crest, and wraps around the side of the body and inserts to this rectus sheath at the front. Now, as you can see, these fibers run transversely, hence the name transversus abdominis. They don't move a joint or bones, so to speak, but they do compress the abdomen by drawing the navel backwards towards the spine. This drawing back of the rectus abdominis compresses the abdominal contents and the viscera against the lumbar spine, in particular the L5, L4 level, and aids stability, similarly to how a weightlifting belt would work. So the rectus abdominis lie on top of this structure, with the transversus abdominis being the deepest innermost structure. So the TVAs are known as one of the core muscles of the body, of the torso, and also as a breathing muscle. And the main role is to stabilize the spine.